11 Eastern Montana critical access emergency rooms will soon have a new tool to help expand suicide prevention programs. Montana Governor Steve Bullock on hand today to explain how $1 million in state funds will help implement community-based suicide detection programs. Currently, Montana has the highest rate of suicide of any state in the nation, a fact that Governor Bullock says is unacceptable. Now, some of the grant money will be used to launch new evidence-based suicide prevention programs that can be utilized by emergency rooms across the state.
Montana has a suicide risk that is highest in ages 45 and older for adult males. What does that mean? That means if we don't intervene soon, if we don't get them to the help that they need soon, that actual risk has now become a reality.
They created an application that uses an algorithm that learns to try and identify the risk, the 72-hour risk for a suicide attempt. So the app, what it'll do is, you hand this to a patient, the patient enters in answers to about 8 to 11 questions, takes less than a minute, and the application spits out low risk, medium risk, or high risk for suicide in the next 72 hours.
The new app that Dr. Arzubi referred to has been in trial use at Billings Clinic for the past several months. The next step, he says, will be to install the hardware so that program can be utilized at hospitals statewide. By the way, the $1 million in suicide prevention funds comes from a bill that was passed by the 2017 Montana legislature.